Hello, everybody. Thank you so much for joining us today for our webinar on behavioral interventions to support students with emotional and behavioral concerns. Your speaker today is Haylee Heller. Before I introduce her, I just want to go over a few key reminders. We'll be having our talk from 2 o'clock to around 2:50, 2:55. About 5 to 10 minutes at the end, we'll have a question and answer session. So if you have any questions or comments, feel free to leave that in the chat box throughout the presentation. Please remember to mute your sound throughout the whole webinar. And if you're comfortable, you're more than welcome to turn on your video. As I mentioned, your presenter today is Haylee Heller. Haylee is a first-year graduate student in the Educational Specialist Program here at the University of Utah. She attended the University of California, Santa Barbara and earned a Bachelor's of Arts in Psychology and Art. Currently, Haylee works as a graduate assistant at the Ascend program through the UTTEC lab. Once again, welcome. We are so excited to have you here today, Haylee. I am going to go ahead and turn it over to you.
Awesome. Thanks, Annie, for that introduction. And thank you for all joining me today. Like Annie was saying, this webinar is going to be covering behavioral interventions to support students with emotional and behavioral concerns. So thank you to the UTTEC lab for having me. Who am I? I know Annie covered a little bit of this, but just to review, some of my pronouns are she and her. I am a first-generation college graduate. I was originally raised in Montana, and then I moved to Salt Lake for the University of Utah School Psychology program. Like Annie was saying, I attended the University of California, Santa Barbara, where I studied psychology and art. And I also was a research assistant for a child developmental lab. Some of my experiences include teaching as a substitute teacher, teaching as a resource room teacher, managing a private special education school, and working at an abuse prevention center. Currently, I work for Dr. Fisher's UTTEC lab at the Ascend program, and the Ascend program is a day treatment that is geared towards children with emotional and behavioral concerns. And it holds a really special place in my heart. So that is what this webinar will be covering today. So today we're going to cover emotional and behavioral disorders and how they can affect students' experience in schools, alternative education settings, school-wide positive behavior intervention supports, and evidence-based practices that can be implemented in schools to support students with behavioral concerns. So I'd like to start off this presentation by introducing the population who have emotional and behavioral concerns. So students with emotional and behavioral disorders, or EBD, include a diverse group of individuals with externalizing, for example, non-compliant or aggressive behaviors, internalizing, for example, anxious, depressed, or socially withdrawn, and comorbid behavior patterns. Although prevalent rates estimates vary dramatically, estimates suggest 12% of school-age youth have moderate to severe and 20% have mild forms of EBD. Some of the disorders that may fall under the EBD in the schools include bipolar disorder, conduct disorder, and psychotic disorders. We will focus on the IDEA definition because most of the interventions in this presentation are school-based. The IDEA category for which students with EBD are most likely to qualify for special education is emotional disturbance. Children with EBD are especially at risk of difficulty succeeding in their public education and can interfere with teachers' efforts to educate other children in the classroom. Unfortunately, the externalizing and internalizing characteristics of students with EBD have been described as incompatible with many schools' goals. So for instance, teaching students new material and academic engagement. These behavior difficulties comprise their ability to meet the expectations of their teachers, such as self-regulation, academic focus, and positive interactions with peers and adults. This can result in students being removed from instruction and therefore missing learning opportunities. Students with EBD are more likely to fail out of courses, have higher school dropout rates, are unlikely to attend college, and have significant difficulties with social relationships and employment as teenagers and adults. So it's essential to take a holistic perspective on behaviorally at-risk children. Behaviorally at-risk children begin their school careers accompanied by a history of exposure to multiple risk conditions within their family, neighborhood, and community contexts. Many of these children become unresponsive to the necessary demands of the schooling process. I really want to highlight that it's also crucial to move behaviorally at-risk children off this negative trajectory or pathway as soon as possible in their school careers. This can be accompanied through early coordinated interventions delivered through collaborative partnership agreements between child behavior experts, parents and caregivers, school staff and peers, and community agencies. Interventions on how to better support behaviorally at-risk children will be the primary focus of this webinar. So what are alternative education settings? And alternative education settings comprise of a broad classification of school settings and programs outside regular public schools. The designation of AES refers to self-contained, behavior-focused alternative schools distinguished by their use within the continuum of services for students with or at risk for EBD. How do students get to an alternative education setting? Students are frequently served in different educational environments because their behaviors interfere with the learning of others and their own individual ability to learn. Nearly a third of alternative education settings report the placement of students as a result of a functional behavior assessment, an FBA, while about 60% of districts cite verbal or physical behavior as a reason for transferring students to alternative education settings. About 13% of school-age students from the ages of 6 to 21 receiving special education services for EBD attend a separate school outside of the public schools in their own district. The US Department of Education estimated over 10,000 alternative education settings in the country, which is considerably more than what was estimated the 460 alternative education setting schools 30 years ago. So this suggests that more students are being served in alternative education settings than ever before. Alternative education settings are also important for youth at risk because they provide intensive behavioral, social, and academic intervention that may be challenging to deliver in a less restrictive setting. For many students, placement in an alternative education setting represents a last chance for acquiring meaningful help outside of an inpatient unit. So this really resonates with me specifically because the unit I work for is one of the last opportunities for these children before they move to a more intensive program. And this is why we want to provide these students with the best possible supports for their difficulties. We're going to cover the multi-tiered systems of support because we will be talking about different tiered levels of interventions. And I thought this would be a great introductory start to the tiers. So a multi-tiered system of support, or MTSS, is an umbrella term that includes academic, social, emotional learning, and behavioral considerations in data collection and intervention planning. It is a comprehensive system of framework that is intended to proactively and continually address every student's needs at a school site. When thinking about MTSS, it's more of how do we proactively put in place intervention supports and instructional strategies to meet the needs of all students, as opposed to waiting for the students to maybe struggle or fail before we have the interventions or instructional supports available for them. So some examples of the systems in place. Sorry about that. So for example, some of the Systems in place in MTSS include school and community collaboration, curriculum design, positive behavior intervention and supports, professional development, response to intervention, and parent collaboration. And specifically for this presentation, we'll focus on behavioral aspects of support systems and specifically school-wide positive behavior intervention supports. An essential part of providing EBD development in the school context is using a three-tiered prevention model. Such models provide a framework for delivering validated interventions to address behavioral needs. This is critical for preventing these difficulties and allows students to respond more effectively to current instances. School-wide interventions meet the needs of all students within the entire school and potentially reduce the number of students identified with EBD and who could eventually transition to an alternative education setting. So we have tier 1, tier 2, and tier 3, which I will go into a little bit more depth on the slides coming up. So as you can see, the tiers build upon and support one another. For example, the behavioral expectations for students are similar across the tiers of the intervention. The tiers are linked with a set of decision rules that signal when it may be necessary or appropriate to develop more intensive individual interventions. An essential aspect of this approach is that each tier needs to include an array of evidence-based practices so that implementers can feel confident that the methods they will use will bring the desired positive outcomes for the systems, providers, and the consumers. So as three-tiered models of support continue to gain recognition for preventing problem behaviors from occurring and responding to the existing concerns, this knowledge base must be continued to be developed. Tier one is universal intervention and is directed towards the entire student body with the intention of building students' social and emotional interpersonal competence. Tier 1 establishes the foundation for delivering regular proactive support and preventing difficult behaviors. Tier 1 typically serves approximately 80 to 85% of the school population. Some evidence-based practices of Tier 1 include data, consistent policies, professional development, and evaluation. And these are all really essential components for these practices to work effectively. Another essential component is evidence-based practices. It's vital, and it may include explicit teaching and modeling of school-wide behavioral expectations for students and positively reinforcing displays of that appropriate pro-social behavior. I also want to highlight that data-based decision-making is necessary for MTSS to function properly. Data is used to select, monitor, evaluate outcomes, practices, and systems. Collecting data and using data for decision-making allows teams and schools to consistently engage in data-driven processes, such as universal screening, targeting students for intervention, and monitoring implementation efforts. Some of those data collection could include screenings or attendance data, and some examples of Tier 1 could be positive behavior intervention, social emotional learning, and restorative justice. Some of the examples of Tier 1 interventions at the program that I have my current graduate assistantship at, the Ascend program, would be the Principles 200 Club and a token economy. We won't be covering either of those today, but those are some food for thought. As a student's progress is monitored through data collection and review, Tier 2 supports are provided for those who do not respond to Tier 1. So Tier 2 is targeted intervention directed at students with behavioral difficulties who may be at risk for potentially developing EBD, as determined by their lack of response to the universal interventions at Tier 1. The goal of Tier 2 is the efficient provision of resources to intervention with high contextual fit and social validity. The interventions are likely to result in a positive impact for a significant number of students who are at risk for reoccurring behavior problems. Equally essential in considerations are early identification, teaming, and data-based decision-making. So tier 2 is typically needed for approximately 15 to 20% of the school population if tier 1 is in place with fidelity. And that's extremely important that tier 1 is in place with fidelity and all of the systems are working correctly. Otherwise, tier 2 and tier 3 will not be working appropriately. So interventions at tier 2 are delivered in small groups, should be put in place short term, and can be minimally individualized to avoid the one-size-fits-all system where every student who requires tier 2 supports receives the same intervention. To reduce the levels of risk for emotional and behavioral disorders and over-identification for special education in this category, tier 2 interventions must be feasible, effective, and efficient. Many schools do not have the time or the resources to provide comprehensive, individualized behavior support for all students who need varying levels of extra support. For example, in a school with a population of 500 students, it is estimated that approximately 15 to 20% or 75 to 100% of 100 students will need more support than what the school-wide prevention efforts provide. Conducting intensive individualized interventions with all of these students would be completely unmanageable and tax the school resources beyond their capacity. So many of these students will successfully respond to simple intervention strategies that are less time intensive and more cost effective. So utilizing tier 2 programs will reduce the overall number of students who need individualized support at the tier 3 level. Tier 3 is implemented if students are not responding to the behavioral supports from tier 1 or tier 2. It's typically needed for 1 to 5% of the school population, and the interventions are delivered in specialized settings, such as an alternative education setting and specialized education classrooms. The interventions are targeted, they are delivered individually, and they significantly increase in the expertise and the collaboration. It's important to consider that all students who do not respond to tier 2 interventions may require these individualized supports, and they may also be eligible for special education identification. The data collection of tier 3 includes behavior intervention plans, individualized education plans, and discipline records. Some examples are one-on-one sessions with a counselor, targeted help with a specialist outside of the general education classroom, social skills training, functional skills in class, and just simply individual support. It's noted also that effective interventions in alternative education settings share very common features with tier 3 interventions that are in place in all other educational settings, but they have a lot more intensity. Now we're going to cover the school-wide positive behavior intervention and supports. School-wide positive, or I'm going to start using PBIS. School-wide PBS is an evidence-based framework that is an entire systems level of approach. It improves school climate by building the socio-cultural and behavioral supports needed for schools to be effective learning environments for all students. The approach builds on the 3-tiered prevention model, and school-wide positive behavior support is under the umbrella of MTSS, which we just covered. School-wide PBIS specifically focuses on behavioral support, which is the primary focus of this webinar. Some of the overarching goals of school-wide PBIS across schools and non-classroom settings are to provide and promote a positive school climate, prevent problem behavior, and improve social behavioral outcomes for all students. School-wide PBS is not a curriculum or a program, but rather it's a prevention-oriented framework to assist school personnel with the organization and implementation of evidence-based practices. As school-wide PBIS is implemented with high levels of treatment fidelity, most, and this is approximately 80% of students, will respond to tier 1 support, while others may require the tier 2 and tier 3 support. Schoolwide PBIS is a very well documented strategy for establishing a positive school culture at the universal level. Evidence from two descriptive case studies suggests that intervention paralleling school-wide PBIS in specific alternative education settings were successful for decreasing problem behaviors and accelerating appropriate behaviors among students with some of the most significant and challenging needs. Results indicate a relationship between school-wide PBIS and reduction in office discipline referrals, truancy rates, improvements in the school climate, and mental health functioning for elementary age students. So what does this mean? Well, it means that school-wide PBIS is a great foundational method for supporting all students at a Tier 1 level. This study here was really exciting for me and gives another great example of how effective universal supports can be in the short and long-term durations. So the experiences at Centennial School demonstrate the usefulness of school-wide PBIS for restructuring alternative school environments that serve some of the most significantly involved children and youth among the school-aged population. The predominant use of school-wide PBIS is advantageous because it helps build rapport with the students who have histories of poor adult relationships and failures in schools. It focuses teacher attention on appropriate student behaviors and the subsequent reinforcement of those behaviors rather than on the misbehaviors and the use of punishment. With the introduction of school-wide PBIS, and its emphasis on positive and proactive interventions, the Centennial School has virtually eliminated the use of reactive approaches, such as physical restraint and seclusion timeout, which is a really big deal in these settings. So if you can direct your focus on to figure 1, we will address the short term. This was the 1-year effects of school-wide PBIS. So prior to the implementation of the school-wide PBIS, there were 112 physical restraints that were conducted during the first 20 days of the school year, which is crazy to me, but it happened. And the number of physical restraints increased to 233 after the first 40 days of school. The use of restraints significantly declined to only 1 during the last 40 days of the school year and none during the final 20 days of the school year. So compared to the prior year, the number of physical restraints has declined by 69%. And Centennial School has continued to sustain the use of the school-wide positive behavior intervention supports approach. And we're going to talk about that in the next graph. So here in the second figure, or it's labeled as figure 4, we see a longitudinal study where the school-wide PBIS was implemented over a 15-year period. And data show that the rate of physical restraints at Centennial School have declined by 99% compared to 15 years ago, suspensions by 88%, police involvement was down by 95%, and the truancy has declined by 64%. Seclusion timeout has virtually been eliminated from the school setting, which makes me very happy to hear. And this really goes to show that if Tier 1 supports are implemented with fidelity, they can have a positive and lasting support on an entire school environment. So we're going to cover some of the evidence-based practices. The value of targeted interventions has gained more attention as educators continue to search for highly efficient strategies for preventing and addressing these problem behaviors. Evidence-based practices for children at risk for emotional or behavioral disorders should be categorized by manualized interventions, diverse samples of populations, multi-site collaboration, and multiple outcome domains, including behavior, impairment, and academics. So to date, relatively few studies reported in the educational literature have actually met this profile. So today we will be covering check and connect, check in, check out, first step to success, coping power, and check, connect, expect. I wanted to take a moment to see if anyone here has implemented any of these interventions or is just simply aware of them. Can I get a thumbs up or a hand raise with the emoji and see who has experienced any of these? Awesome. Okay, so this is Check and Connect. This intervention brings to light how important a connection between a student and an educator truly is. This is something that I'm sure a lot of educators, including myself, can speak for and agree upon. Check and Connect has been demonstrated to maintain school engagement and reduce problem behavior of middle and high school students with emotional or behavioral disabilities. The overall program relies on an adult mentor to supervise, monitor, provide feedback to, and problem solve with students concerning their behavior in school. The check component of the program consists of the mentor employing daily monitoring procedures for school risk factors. This includes tardiness, behavior referrals, detention, suspension, grades, and credits. The connect portion refers to the mentor forming positive relationships with students in order to implement 2 levels of intervention for student progress, monitoring of risk factors. The basic level of intervention at Check and Connect consists of providing daily feedback to the student about his or her progress, discussing the importance of staying in school, and problem solving with students concerning risk factors noted by the mentor. The intensive level of intervention is implemented based on the individual student's needs for additional support. This can include social skills groups, individualized behavior contracts, and problem-solving sessions with parents. Check and Connect is considered efficient and effective at a tier 2 intervention level for students with behavioral difficulties. Results from Check and Connect suggest that it is a successful intervention for decreasing dropout rates, increasing school completion, and increasing attendance for students at risk for emotional or behavioral disabilities. Check and Connect is useful and reliable intervention that can be used for middle or high schools. Now we're going to take the time to check out this video.
Check and Connect is a program we have in our school. I would call it an intervention.
It's effective because we're finding out where the needs are and working with those kids who really need it.
In general, if that's a student that we're looking at and thinking they really just need someone in their life, we automatically go to Check and Connect.
We do it around the data we received from the school administration staff, their grades, suspensions, time out of class.
When Check and Connect came, I thought this is what kids need, to build relationships with someone who cares about them, knows them, and wants the best for them.
I usually try and find some common ground, some common interest.
First, I'll talk about what's going on in my day, and then we'll try and change it to like put it in perspective of basketball.
I share a little bit about myself and who I am and my goals and my purpose in working in the field that I'm working in.
A lot of it requires me to be vulnerable myself and share with them like, hey, like we're on the same page.
You start by trying to build trust, and that's very hard in any facet of life.
When I first get a student on my caseload, I like to try and call home, just kind of introduce myself, talk about the program. And I think the biggest part about it is focusing on the positives.
The biggest thing is that those students are feeling connected to someone in the building and that they have someone they can go to.
I have one mentee who confidence has been a struggle for him. His teachers had been talking with his mom and meeting with her. She was starting to kind of get on his case, and he actually came to me and he was talking about how no one was focusing on the positives. So then I followed that up, talked to his mom, told her about all the things he was doing well. She was really happy to get that call and then relayed that message back to him.
Before, I thought I couldn't cope with being in sport and school at the same time. Since I have a mentor, he puts me in how much time should I spend like on sports and how much time should I spend on homework.
So there's a student that I've gotten to know really well last year. He's had a really rocky relationship with school. He will show up to school and say, I give up and I'm done and I'm like, this isn't for me, and then he will leave. This is all I can do. Like, I can't drag you to do anything. That's, you know, the roller coaster ride that you ride as a mentor.
My mentee and I have a fantastic relationship. I see her multiple times every day.
I never really reached out, and I was just this kid that was like completely different from everybody else. It was hard for me to go through another day.
She can always have like that one person that she can always just go to and say, yep, this person is here and they still care, and no matter what I do, they're gonna be here and we're gonna work through it.
Worked out pretty well because like we've been through the same situations. I love talking to her and seeing her every single day.
When I work with these young men and I see them care for once in their lives and feel like someone is actually there and pushing them to want the success that they deserve, it's powerful for me.
Everything about our school feels better when students feel engaged, and they're engaged when they feel like they're successful, when people care about them, and when they belong. So it has a benefit both for the students and their individual success, as well as for the school and our culture and our overall success in accomplishing our mission.
You don't always see success come right away, but after a month or 2 months or 3 months, you're checking their grades and you see, oh, they retook a test. Their grade just went up 14%. And then went to go tell my mentee that, you're done with chemistry. Now you passed these proficiencies. Her face lit up.
Each one of these kids are so unique. They all have their own special gifts and talents. Some of them are just putting them on hold because of the circumstances and things that they're going through. But I'm seeing that that's maybe part of my job, to help deal with some of those issues and complications in order for them to free up that space where they can be themselves and they can utilize their gifts and talents in order to have some other successes in life. When I have a mentor now, it's like my goals are like succeeding and they're getting higher every day.
Well, we have one family that their son is on the route to graduate. He's been working extremely hard. He's been pushing himself, and his mom and dad are so ecstatic, and they just cried, and they're like, we can't believe it. Can't believe he made it. He sent me my invitation, and I told him, I said, I'll be right there next to your mom and dad. They'll probably be cheering a lot louder than me, but believe me, I'll be your cheerleader that day too.
Okay, so that was a great video to highlight the Check and Connect intervention. Now we're going to move on to check in, check out, CI, CO. This is a widely used and recognized intervention that I'm sure a lot of individuals have come across at some point in their educational careers. From my understanding, this is considered the go-to intervention. Check in, check out is designed for students who demonstrate persistent problem behavior in classroom settings. These are students who do not respond well to the school-wide behavioral expectations, nor to preventative classroom management practices. A primary function of the check in, check out is to improve the overall efficiency of the school procedures while reducing the number of individualized interventions that are needed. Each day will begin with the student checking in with a mentor to review goals and ensure readiness. At this time, the student receives a daily progress report, or a DPR point card, which lists behavioral expectations and includes a place for teachers to rate their behavior throughout the day. Next, teachers rate student behaviors on the point card and provide a brief verbal feedback during naturally occurring transitions throughout the day. At the end of the day, the student checks out with the mentor to determine if point goals were met, briefly discuss performance, and receive rewards if the goals were met. Finally, the student brings the point card home, and a parent or guardian reviews the student's performance, provides encouraging feedback, and signs the card. The signed card is then returned the next day as part of the daily check-in process. Check in, check out is a widely researched tier 2 intervention with promising evidence for effectiveness. Research has demonstrated that check in, check out results in improved student behavior, such as reduced office discipline referrals and problem behaviors, as well as increased academic engagement. Check in, check out also has been effective with elementary, middle school students in alternative residential settings for students with emotional and behavioral concerns. It is designed to be implemented for about 5 to 15% of students in a school system who are identified as being at risk in part of the MTSS system. Personally, I have never seen this intervention in practice, but I do believe that it could be a great fit for a program and probably for the program that I'm currently in. So this is an example of the point card that lists the behavioral expectations. The daily progress report provides regularly scheduled intervals for teachers to provide feedback to students about behavioral preference and award points for meeting those expectations. During the afternoon checkout period, students' points are totaled and then converted over to a percentage. Each student's daily percentage is then graphed. And the Tier 2 team decides or uses these graphs to monitor a student's progress over time and to make decisions about the intervention. So this could be to fade the intervention, to maintain, to modify, or even to ramp it up and intensify it. And there are several considerations that I wanted to touch point on when creating a daily progress report for your school's check-in, check-out program. Some of the suggestions include stating the school-wide expectations. So expectations and behavior should always be positively stated. It should be teacher-friendly and easy to complete, so allowing for circling of ratings rather than any type of narrative feedback, and the design and content should include a minimum of 4 rating periods that correspond with the natural transitions of the day, and optimally, the periods are no longer than 75 minutes. Okay, now we're going to go on to first step to success. First step to success is an intervention that I found through my research preparing for this specific webinar. It's an early intervention program designed to help students who are at risk for developing aggressive or antisocial behavioral patterns. This can include aggression, oppositional defiant disorder, severe temper, or victimization of others. This is a secondary level intervention and appropriate for students who experience moderate to severe behavior problems and are at risk for academic difficulties. The program uses a behavior coach who works with each student and his or her class peers, teacher, and parents for approximately 50 to 60 hours over a 3-month period. First step to success includes 3 interconnected modules. Number 1 is the proactive universal screening of all kindergarteners. Number 2 is the school intervention involving the teacher, peers, and the target child to teach the adaptive behavior patterns. And then number 3 is the parent or caregiver training. And this involvement is to support the child's school's adjustment. A key part of this specific program is the behavioral coaches who act as caseworkers for about 2 to 3 of the students and are responsible for implementing and coordinating the school and home components of the intervention. Coaches are typically trained through lectures, demonstration, role-playing, skill practice, feedback sessions, materials, and self-evaluation. Training, monitoring, and supervision processes are implemented to build the fidelity. The strategy of the program relies on having the coach to work with the teachers and parents to give them the skills to teach students replacement behaviors and reward these students when those behaviors are used appropriately and consistently. Strategies for implementation include schedules for praising and awarding points, prepared scripts, daily task lists, and guidelines for application. Students are taught specific skills and behaviors to use in place of inappropriate behaviors they may have previously used in the past. More specifically, during the school day, the coach or the teacher of the first step to success gives the student visual cues. So this is either a green card or a red card. And the green or red cards indicate whether or not the student is on task and using appropriate behaviors. Throughout the day, the student accrues points toward his or her behavioral goal. And if the student makes the daily goals, he or she gets to choose an enjoyable activity the whole class can do and appreciate. And this is a great intervention that implements a dependent group contingency where a student can earn a reward for their whole peer group. Each evening, students receive feedback about their day, their child's day, and the parents are also trained in 6 weekly meetings with the coach. And they're encouraged to reward the students' positive behavior at home by spending extra time with them, doing activity. This could be playing a game or taking a walk together. There are significant positive effects that have been documented on multiple measures across multiple domains with First Step to Success. Differences between intervention and comparison group students demonstrate that students who participated in First Step made significantly greater gains in pro-social and adaptive behaviors and reduced their problem and maladaptive behaviors. So this is a really cute video, and we're going to watch this clip. It really resonates with me because I have experienced a lot of the situations that are described in this video. So I look forward to sharing with you all.
When do you learn more, during green card behavior or red card behavior?
Green card behavior.
How does green card behavior make you feel?
I'm happy.
That's good, I'm glad.
Overall, I had students that would throw chairs. I would have students that would throw tantrums in the middle of the hallway. I would have students that would say not so nice words.
He was biting, he was running out of the classroom, he was running under tables.
I mean, I would be crying at the end of the day. I didn't know how I was going to make it through the year.
Recently, there's been a lot of, I call it falling out, where they kind of throw themselves on the ground if they don't get to do something that they want. For some reason, they've been pulling their shoes off and throwing the shoes. I've seen that a few times. I'm not quite sure why.
And so it's like a nice way to redirect them without having to be like, hey, stop playing with the chair. Stop playing with the chair.
Stop doing that. Don't do that.
You know that's wrong because this and this and this and this and this.
Sit down, be quiet, sit still, stop talking, put your bubble in. It's like they're just here.
You just flip that card. Don't give them any feedback. Don't give them any of that attention that they're craving. It's just very simple. You flip it back to green. Hey, great job. Then they get what they need. They know they're doing the right thing. They get that positive reinforcement.
The reason First Step works so well is you're using the 3 most powerful change agents in the kid's life, which is the teacher, the classroom teacher, the parents, and then the peer group.
He was so excited when he got to earn his points. And the class too, with that whole points, they cheered him on when he earned them. It was like, come on, did you earn those points yet? Can we have our reward? And he, that kind of gives them that little extra. So it worked. I would do it again, definitely.
If you have a green card, you be good and get points. If you have a red card, you don't get points. But you can try again tomorrow.
Hello.
So our game, we're going to start, and Noah has chosen balls. And he's going to be working on being cool, right, Noah? All right, being cool it is. Are you ready? All right, here we go. If we run in and we're trying to get in line, is that red card or green card behavior?
five.
Thank you. Good job. High five.
Do you remember something you learned from the game? Yeah.
What did you learn?
I learned to behave, listen, and follow the witch.
Oh my God, you learned all that?
Positive behavior is positive teacher, is positive classmates, is positive classroom, is positive experience. I mean, it all just flows together.
This program, because of the simplicity of it and just the immediate feedback, could really benefit a lot of special ed students. And I just hope that, that other people, hear about it and use it, because it really does work.
If I did not meet the kids prior, myself, and had a visual of myself, I wouldn't believe that these kids had these behavior in the beginning. So I'm glad I was able to witness and observe and collect data prior to starting the First Step Next program. So I was able to actually see their growth and how they matured over the few months that we was doing this.
I really enjoyed seeing how their socialization turned around. You would have a kid that everyone was afraid of. He was aggressive. He was angry all the time. No one wanted to play with him. Now they invite him to play. They say, come play with us. Come join our group. Come do this. And the kid lights up. It's a new kid.
I feel lucky to be chosen for this because it's like, I don't know, it's made my job enjoyable again. It was like, getting to the point where it was like, what are we going to do? Nobody wants to go to work and get that.
Okay, I thought that was a really cute video with having them have the little kids describe their experiences. And it highlights that it's effective. I don't know the validity of the graphs and the data that is in this specific video, but from the research articles that I have found, there is a lot of validity to it. Okay, so coping power. The Coping Power program is for high-risk children and addresses deficits in social cognition, self-regulation, peer regulations, and positive parental involvement. The CP program has both a child and parent intervention component and is designed to be presented in an integrated manner. The child component consists of 34 group sessions, and the child component focuses on anger management, social problem solving, and practicing skills to resist peer pressure. The parent component concentrates on parenting and stress management skills, while the child component involves the use of school-based focus groups and emphasizes anger management and social problem solving skills. Parents also meet with the Coping Power staff to help them understand and prepare for future adolescent-related and general education issues, and to give them the specific tools necessary for a smooth transition into their next school. The Coping Power program is a multi-component intervention based heavily on cognitive behavioral therapy, which emphasizes increasing and exercising parenting skills and the development of child social skills. Children receiving the intervention were rated by teachers as showing improved social skills, less aggressive beliefs, and less anger from social problems. And they perceive themselves as more academically competent. In a comparison study with both Coping Power and Check-in, Check-out, they both produced positive change in externalizing behavior. Only the Coping Power intervention produced changes in the participants' broader emotional and behavioral functioning and at-risk status. So why would Coping Power have a broader effect on children's emotional and as well behavioral functioning? So the structure of Coping Power differs from Check-in, Check-out in some distinct ways. So check-in, check-out is delivered by a coach that requires daily ongoing attention and check-ins, the DPR ratings and checkouts. Whereas coping power intervention is delivered in a small group. It is isolated instruction by a neutral interventionist who is specifically focused on the relationship building. And coping power is a transdiagnostic intervention with multiple mechanisms for change, including social perspective taking, emotional awareness and regulation, and goal setting and problem solving skills. And last but not least, we have Check, Connect, Expect. This program combined the essential intervention procedures of Check and Connect program and the Check-in, Check-out program. Check and Connect and Check-in, Check-out rely on positive and caring adults who provide daily interactions and structured supervision with students who have behavioral difficulties. These positive, caring adults are referred to as coaches in the Check, Connect, Expect program. The coach frequently checks in with the students and provides them with feedback on their academic and social progress. The coach helps students set daily social goals for success and provides students with reinforcement when they do meet their goals. In addition to supervising the daily progress of students, the coach helps the students to overcome social difficulties and acquire new social skills to be really successful in their school. Students are taught to self-monitor their behavior before graduating from the program. And the coach is responsible for providing these services, and they serve as a positive role model for students with behavioral difficulties that interfere with the student's success. I'm going to briefly go through this. Across 2 years of using the CCE program with students having numerous behavioral risk factors, only 20 out of the 104 or 19% of students were referred to or identified for special education. So this suggests that the intervention was helpful in preventing emotional or behavioral disorders. Finally, students who graduate from the CCE program have been found to improve their social skills and make more significant decreases on measures of problem behaviors when compared to the non-graduates or the students in comparison schools. What else? So as a mental health and behavioral health provider, a question you can ask yourself is, what can we do to help meet the students' needs within these specific environments? So it's really important to highlight the type of interpersonal relationships that students and teachers develop, and they are major factors in a child's positive social development. Studies have concluded that the quality of students' relationships with school staff is connected to students' broad outcomes. Supportive, responsive relationships among adults and children are an essential component to promote healthy educational development. So it's important to build these healthy relationships with students. And once we've done that and we've made those foundational deposits, then we can start to repair their emotional and behavioral banks. I'd also like to highlight and address that there is a certain level of intensity that is really needed to get the outcomes that we want for students with specific needs. And sometimes that is not just 1 hour once a week that's written on their IEP. Research shows that the best level of intensity is consistent intervention throughout their entire day and is embedded in natural teaching opportunities that would happen in the everyday normal environment. And before an educator moves to implementing Tier 3 intervention, it's highly recommended that an FBA occurs. I'm just slipping this in here because I thought it was really important. An FBA is most often considered a Tier 3 activity that is implemented after a student doesn't respond to a Tier 2 support plan. They're integral elements when providing school-wide positive behavior supports to students who exhibit challenging behaviors in schools. Research suggests that the intervention results from research show that the intervention indicated by the functional analysis was more successful in reducing off-task behavior than the non-function-based behavior intervention plan. Data is so important because it helps us to target exactly what's going on and really helps guide us with these solutions to help these individual students. Using data in a precise and targeted way helps us be more efficient and effective in our roles as support providers in schools so that we can truly make a difference in the lives of our students. Some final considerations is that there is a lack of great alternative education programs. Tier two and 3 are significantly less research than tier 1 supports. There are no studies out there that have been able to monitor a student's progress and with their responsiveness to a school-wide intervention plan, and then use data to identify students requiring secondary prevention, and then use more data to monitor how students respond to secondary prevention, and then identify and support students who are non-responsive to the secondary prevention, and then again, design and implement and evaluate these third level prevention plans. It really doesn't, I couldn't find anything. So if anyone out there is aware of something like this, please send it my way because I would love to read it. And the impact of aggressive behavior. So once established, aggressive behavior can in childhood may become a stable behavior pattern. These high levels of impulsive, uncontrolled aggression in childhood serves as a predicator for substance abuse, delinquency, and other negative outcomes during adolescence and adulthood. Children who begin their careers with serious limitations in these emotional and behavioral areas often fail to get off to a good start in the school and to derive the maximum benefits from their teaching and from their schooling. It is utmost of importance to move these behaviorally at-risk children from this progression as soon as possible in their school careers. And this can truly be accomplished through coordinated interventions. All right, and these are some bullet points that sort of summarize and wrap up what this presentation was about. I'm not going to read them to you, but I would like to take a moment to thank everyone that supported this webinar, especially my supervisor, Dr. Diana McCartney, Dr. Erin Fisher, Lauren Martone, and Elizabeth Goldsmith. You guys have been so amazing and so supportive. You are all extremely supportive and have been pivotal roles in my experience as a graduate student in this program. So thank you guys.
Awesome. Thank you so much, Haley, for a great webinar. With the remaining 3 minutes or so that we have, we'll open it up to any questions or comments. So feel free to drop those in the chat.
What do you think is holding some people back from moving forward, like with more positive approaches?
Personally, I think that old patterns die hard. And so unfortunately, it's really hard to implement these school-wide practices when there's been practices that have been implemented for, let's say, 20, 15, however many years. And it's really hard to make a systematic change. And especially if everyone isn't on the same page, everyone really needs to be all ready for it and wanting to make the same positive impact. So I really think it comes down to that old habits get stuck and that everyone needs to be on the same page. Thanks, Lauren.
We have a question for Victoria. With first step, is there any type of debriefing or behavior specific feedback given?
Regarding which intervention?
First step.
First step. As far as I know, there wasn't any debriefing, but I can definitely send you some of the articles. And if you want to fish through that and let me know, that'd be great.
Awesome, thank you. And with that, that concludes today's webinar. One big virtual round of applause for Haley for today's webinar. You can find all up-to-date webinars, including this recorded webinar on the UTTEC Lab website, which you can access by going to www.u-tteclab.com. Again, thank you, everybody. for attending.